Here's a massage video that you can use to help treat patients with poor posture and shoulder protraction. The muscles responsible for shoulder protraction are the serratus anterior and the pec minor, which can become overactive and tense, while the muscles that stabilize the joint, such as the rotator cuff muscles, can become weakened and less effective. So the rotator cuff muscles are the subscapularis, the supraspinatus, infraspinatus, and the teres minor. These muscles play an important role in moving the shoulder and keeping it stabilized. When the rotator cuff muscles are not functioning as they should due to poor posture, it can result in restricted range of motion and difficulty in raising the arm overhead or even performing external rotation or internal rotation of the shoulder. So let's begin. We're going to start by going through some passive range of motion of the client's shoulder. So first we're just going to make sure that their joint is loose and relaxed. And then we'll go into external rotation, just feeling for where their end range is. And then internal rotation. We'll go into an extension and flexion. Okay. So I want to begin with some effleurage just to introduce your touch. And then some petrissage just to get those muscles warmed up. Making sure you're reaching all the origins and insertions of the muscles. And what we're looking for here is trigger points, tense muscles, adhesions. Basically problem solving for why your patient can't move their shoulder through full range of motion. So I'm feeling some tension along the upper traps here. And the supraspinatus. To work on these trigger points, you can just use some repetitive muscle stripping. I like to combine the stripping with ischemic compressions. Other muscles that are important to focus on with shoulder treatments are the upper, middle, and lower traps. The lower traps are typically one of the weakest muscles in the back, just because we're all hunched over. So if your patient is here due to poor posture and shoulder protraction, definitely work on those lower traps. It's important to reach the muscle all the way to where it attaches along the spine, even working on the erector spinae too. Feeling a trigger point here. So to avoid strain on your thumbs and knuckles, I like to use my elbows for ischemic compressions as well. And now to work under the shoulder blade or get into the rhomboids, I like to have their arm hanging off the side of the table rather than putting it behind their back, because if they're here for a shoulder injury or shoulder protraction, then they won't be able to hold their arm up on their back for a long period of time. So I'm just going to start digging around the medial border of the scapula. Just using some fingertip kneading. And now I'm going to go into a pin and stretch for the teres minor. So the teres minor is a small rotator cuff muscle that goes from the lateral border of the scapula and attaches under the armpit here. So I'm just going to hook my arm under their elbow, find with my knuckles, I find this the easiest way, to compress the teres minor. And then just lift their arm up. And while the arm is getting lifted, I'm just slowly running my knuckles down the length of the teres minor, feeling all sorts of crunches in there. While I'm doing this, I'm also stabilizing my elbow with my hip so I can use my body weight to apply more pressure to the muscle. You're also getting into the lats here too, which do play an important role in shoulder rotation. Then just do some flushing after you do any sort of deep pressure. Now we're going to get into the external rotators. So your infraspinatus, which lays right on top of the shoulder blade, this is an important muscle for external rotation. And you can feel it. You can feel when you're on it, by bringing their arm into external rotation, and you'll feel the muscle pop right along this border here. So what I'm going to do, make sure I'm on the muscle. And the same thing that we were doing with the teres minor, while the muscle is being activated, we're just going to slide and strip down the length of the muscle. And just do some gentle rocking of the shoulder joint. Make sure everything's staying loose and they're not tensing up. Now, there's two ways you can get into the subscapularis. We can do it with the client prone and the arm off the side of the table by sliding up the lats and hooking our hand right under the shoulder blade. And you're standing on the other side of the patient's body. Just hook your fingers gently and just slowly lean back or sit back, and the fingertips will pull the shoulder blade up and give that subscapularis a nice stretch. I'll hold it for maybe 15, 30 seconds, do some flushing, and then do it again. You can add some gentle rocking too. That'll just help relax your patient's nervous system. Sometimes this can be a sensitive area, and patients at times will have a hard time relaxing while you're in there. And then I always like to incorporate just some stripping along the posterior deltoids. And then finish off with more stripping, then back to effleurage. I like to think of massage therapy as like a treasure hunt. You're always looking for knots and trigger points. That's the treasure. Okay, and now we're going to have the client switch to supine. Okay, so as we said before, the main muscles that are used in protraction are this pec minor and the serratus anterior. So we can access both of those while the patient is supine. So we'll start with the pec minor. Just doing some effleurage, get their muscles warmed up with some petrissage after that. So the pec minor is underneath the pec major, and the only way to get to it is through the armpit, but it's a sensitive area, so we have to make sure that we really warm up these muscles so that the client doesn't tense up and kick us out of the pec minor. And you don't want to have their arm stretched out too much. If their arm is above shoulder height, that's stretching the pec major, so it would make that muscle more tense and make it more difficult to get underneath. So you want their arm to be a little lower than shoulder height so that muscle's all relaxed. And you can start with just doing some stripping, making sure you're always going with the muscle fibers. And then same thing as the subscapularis, go on the opposite side of the body and wrap your fingertips just under the pec major. So I've got a hold on the pec muscles and you can just gently rock, do some muscle squeezing, but focusing on applying the pressure mostly through the fingertips. I've found through my practice that just muscle squeezing of the pec minor feels more tolerable than doing muscle stripping because it's such a sensitive area. Once you hold the muscle long enough, you can actually feel the muscle tension slowly dissipate. So while you're here, you can also get to the serratus anterior. Which is right along the rib cage, just under the armpit here. So I like to put my hands on top of one another, find my line where the muscle is, and just lean back and use my body weight to pull the muscle. And just do a few passes of this, maybe 3 or 4 times. And let's work on the subscapularis, which is on the anterior side of the scapula. So it's really kind of tricky to get to it when they're laying face down. So I like to do it when the client is prone. Have their arm up and relaxed. And on this patient, because he has some lat muscles, it's really easy to find where you should dig your fingers in. But if your patient doesn't have a lot of lat muscle, you want to find where the shoulder blade starts. So what I'm doing is just keeping my hand neutral and firm and just pinpointing the subscap, and then once you're there, lift their arm up and slowly bring it above their head, and you'll feel the subscap stretching as you're doing this. You can either hold it as a pin and stretch, or you can do some active release, so you're constantly moving their muscle through the range of motion while you're pinning it down. And with each time you do it, hopefully, like this patient, you'll feel their range of motion increasing. So what this is doing is stretching out the subscapularis so it will allow them to be able to move their shoulders back without feeling stuck. And then because this is a shoulder massage, you want to focus on bicep, insertion, anterior delt muscles, because once all the muscles on the front of the shoulder are looser, it'll be so much easier. They'll have way more movement in their shoulders so they can learn how to put their shoulders back, again, without feeling stuck. And that is how I work on the rotator cuff muscles for protraction of the shoulder. So if you enjoyed this video and you want to use this in your practice, go for it. And if you have any questions about massage therapy or you would like to see more treatments, just write a comment below and let me know. Please like and subscribe to our channel, and we'll see you soon.